Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I hope by participating in these podcasts, you can take away valuable information that can enrich your life. We are always looking for topics of interest, so please email us at oakbendhappyhourpodcast@obmc.org. Today, I want to welcome a very special guest, Dr. Mehjabin Parkar, MD. Dr. Parkar is a board-certified family physician for the past 10 years. She has been practicing in Richmond, Texas. She is currently practicing at Oak Bend Medical Group. She completed her residency in 2007 at UT Southwestern in Dallas, Texas, with departmental distinction. She was awarded the fellowship by the American Academy of Family Physicians. She recently served as the Family Medicine Medical Director at a federally qualified healthcare center and is chair of family practice of Oak Bend Medical Center in Richmond, Texas. Dr. Parkar cares for patients of all ages, but especially enjoys treating chronic medical conditions like hypertension, diabetes, thyroid illness, psychiatric illness, and HIV medicine. She places special emphasis on preventative health and treats various gynecological disorders in females. She also cares for urgent care patients. Her faith and diverse background has helped her appreciate cultural sensitivity and to provide compassionate care for all patients. She also is so compassionate that she demands to follow her patients in the hospital and provide care both in an outpatient setting and an inpatient setting, which is commendable because that's something we don't see very often anymore. Dr. Parkar, welcome. We're glad to have you today. I am excited today to be talking about diabetes. We have a lot of people that are diagnosed with diabetes, and there's just a whole lot of education that goes along with it, and it's a lot to consume. So today, Dr. Parkar is going to kind of help us maneuver through this. How would I know if I had diabetes?
Absolutely. This is a complex metabolic illness, unfortunately affecting millions and millions of Americans in the United States. So with diabetes, we have two kinds of diabetes. We have type 1 and type 2. Type 1, the symptoms are very dramatic and they come around really fast. They're more found in younger population, and type 2 diabetes is more of a chronic. It can take up to even 10 years before you actually know you have type 2 diabetes. Some of the common symptoms that we see are increased blood sugars, increased urination, increased thirst, increased hunger, dry skin, weight loss, fatigue, blurry visions, tingling in the hands and the feet, and the frequent infections and poor wound healing. So like I said, in type 1, which constitutes about 10%, it's more dramatic and faster, so we're able to diagnose them really fast. With type 2, it can take a long time to diagnose these symptoms. Hence, it's important to see your primary care physician on a regular basis so we can check you out and make sure you're not developing one.
But if I cut back on my sweets and cake and all that, I'll be better, right?
You know, that's another misconception that we have. Cutting back on sweets and desserts and all those lovely, yummy treats that you just talked about, yes, can help you. But once you develop diabetes, it's irreversible. There is no cure, but it is manageable. So there is not just the sweets and the cakes and the fruits, but there's so much more associated with that. There's a dietary, and there's a cutting back on carbs, cutting back on processed foods. So all that will be needed to be incorporated in your diabetes care plan.
So I go, or someone goes and gets diagnosed with diabetes, and you're given a diet to follow. So that means I'm never going to get to eat a piece of cake again, or I'm never going to get to have spaghetti and meatballs again. It's so confusing. How does this all affect my blood sugar?
Yes, Donna. So good question. Really, I look at it this way. I look at it as A, B, C, D, E, and F. The A is the attitude. Really, how much of a denial are you in when you are diagnosed with diabetes? And how much are you ready to listen to your primary care doctor to help you so you can eat the treats and enjoy, as well as manage it so you don't get the complication. B is the blood glucose measurement. Are you checking your sugars to see whether they're high or they're low, and how your treatment affects it? Number 3, controlling the blood glucose or the diabetes that we call with medications and lifestyle modifications. The D is the diet that I was talking about. I'm not stopping you all from eating, or primary care physicians don't stop you from eating everything and anything, but we tell you to limit the portions or to eat the correct things so it doesn't affect your sugars. And the E is the exercise, the lifestyle modification, the exercise that we talk about, and F is the fortitude. So if you follow all these, then we can come up with a beautiful diabetes care plan, and you can eat and not deprive yourself of the things that you like, but it has to be very, very disciplined.
So I understand that carbohydrates and proteins play a big part in affecting your blood sugar. Can you expand on that and tell me how that goes together?
Absolutely. To understand that better, we need to know the pathophysiology of diabetes. So any person, whether diabetic or not diabetic, will eat food. It will go into the stomach and it will break down into glucose. So the food that we eat, which is the starchy vegetables, the carbs will contain the starchy vegetables or the fruits or the rices, the pastas, the cakes. Anything which has glucose or carbs will go into your stomach, will break down into the glucose, and the magic hormone, the insulin, will then act as a key to open the receptors and let that glucose that goes into different parts of our body become, help us with the energy. Okay? So now what happens in type 1 or type 2? Type 1 is very simple. There is no insulin. So we just have to give you external insulin, right? The type 2 people, because either there's increased demand as you get older, or you're overweight, or there's insulin resistance that develops. When that happens, unfortunately, the insulin is not working the way it's supposed to work. So now what happens, that glucose that's supposed to go into your muscles and into your cells and the receptors is now lingering around into your system, into the bloodstream, and it dangerously goes up, right? So we need that sugar to come down so it can give us our energy. So for that, we need to either cut back on our carbs. So that's what carbs does. Every carb that goes into our body becomes sugar. So we need to cut back on our carbs, take our medication so that insulin works better. And then the proteins that you were talking about, proteins are bodybuilding. They don't increase the sugar because they don't have carbs. They have less than 5 grams of carbs. So that doesn't affect the sugars, but it keeps it more sustained. So for example, if my patient is an insulin-dependent diabetic, whether type 1 or type 2 doesn't matter, if you take a protein meal along with a carb meal, which is balanced meal, it'll keep your sugar levels at bay. So what does it help with? People, it doesn't drop their sugars. For example, at nighttime, if you're an insulin-dependent diabetic, it can dangerously go low in the night. But if you take a protein meal before your bedtime, it'll keep it at bay and it doesn't drop significantly. So that helps with my insulin-dependent diabetics. And helps with my non-insulins too. So it keeps the sugar level less fluctuating. So that's how carbs and proteins affect our blood sugar levels.
That is fascinating, and I don't think that's anything that gets explained to that effect. So I hope our listeners are really paying attention to that, because that's good information. Now, everybody always stress, make sure you get your eyes checked, make sure your feet wear socks. Why?
Very good question again. So like I told you, it's a complex diabetes is a complex metabolic illness. So what does it do? Why is it complex? Because it affects microvascular changes and macrovascular changes. Microvascular changes is in our eyes, right? In the small blood vessels, in the kidneys. So our eyes can develop diabetic retinopathy, which is one of the leading causes of blindness in our diabetic patients. So we need to see an ophthalmologist on a regular basis. And American Diabetes Association has recommended us to see a diabetic patient or refer a diabetic patient every 6 months at least to get an eye exam to check whether you have developed retinopathy. If you do develop retinopathy, it can be reversed if it's caught in the early stages by the ophthalmologist. But if it's advanced, then unfortunately you lose your eyes. So that's why it's important to see an eye doctor. Same thing with the foot exam. We can develop macrovascular changes. So it affects your cardiovascular system, it affects your heart, it affects your blood pressure, it can cause you to have a stroke and lose your feet, and you can have poor wound healing that can cause amputations. Hence, a podiatrist or your primary care doctor can check your feet with the monofilament that we check to see whether you have any sensation, whether you have any feeling in your feet. Like normal people without diabetes, if you step on a nail, or you can step on a stone, or you step on a sharp object, you can feel it. And if you develop any ulcer with that, you can take care of it. Unfortunately, with diabetics, they don't have no sensation or decreased sensation. So that ulcer can lead to an infection. And before you know it, is so widespread that it's important to check your eyes and your feet for these reasons.
So if I have someone in the family that's a diabetic, should they trim their own toenails, or should they go to the pedicures, or should they see a podiatrist?
So trimming of foot nails, if they don't have an infection, if you have sensation, no problem. You can do it very carefully. Just make sure you don't trim them too close to the skin, because that's when you cannot get infected. Now, if your nails have become thick because there's decreased blood supply to the lower extremity, and the nails have become thick, and it's hard for you to cut them without hurting yourself, then that's when I would recommend seeing a podiatrist.
So, is it safe to have pedicures?
That's a tough question. The reason being that pedicure, if you go to a good place, that's okay. But if it is not, and there's because when you have small cuts in your feet, and there's chance of infection ascending through those cuts. And when you go for pedicure, and if they don't take care of that, or the water is not changed correctly, there's a chance you may get an infection.
Right. I just want people to understand they need to watch closely when they go to do these things. So you said exercise with diabetics. What kind of exercises do you recommend?
So, there are three kinds of diabetes, like I said. Well, two kinds of main diabetes, but there's also called pre-diabetes. We shouldn't forget that, because people only focus on the diabetes and forget that there's something called pre-diabetes. This is the time when your blood sugars are creeping up, but they've not reached the diabetic range for us to start your medications. That's the time when we talk about lifestyle modification and interventions like exercise. So there were 10, I had looked into 10 meta-analysis of 10 studies that showed that there is a delay in the onset of diabetes, and also reversing type 2 diabetes if caught in the early stages. So there are different kinds of exercise. We have the aerobic exercise, where your heart rate increases by 50 to 75%, and that helps with your weight management as well as diabetes. Number two, the strength and resistance training, which is like people who go to the gym and work out with weights and stuff, and that helps with building muscle tone. Remember, the more the muscle tone, the better your chances of burning the fat. Number three is yoga and Pilates, and those classes, the Zumba classes and stuff that we take. I encourage those because some people who need that motivation to go to the gym and to see that enroll in classes, that actually helps. So these are some of the exercises that help us to build not only muscle strength, but also to help with insulin resistance. Remember, one of the key problems in diabetes is insulin resistance. What that means is that we have the insulin in our body that is secreted appropriately, but now the insulin is not working, either because, like I said, there is increased demand, there is too little insulin, or there is overweight. When that happens, insulin is not working. Now, suddenly when you start exercising and you start, that insulin starts getting more efficiently utilized, and now your blood sugars, which were dangerously high, start coming down on a lower basis. So it's important to check your sugars before and after the exercise, because remember, if your sugars are high and you don't have enough insulin in your body, then that can cause you to go into dangerous diabetic ketoacidosis. And if your sugars are low and you exercise, they can drop dangerously and cause hypoglycemia. So important is exercise, but also to check your sugars before and after the exercise.
So we hear a lot about vitamin D, and you're low on vitamin D, you're this, you're that. Does that affect diabetes in any way?
Yes, there are studies that have been done recently, and in fact, in the past few years, they've been studying the vitamin D is a very interesting topic, and I can probably talk an hour just on vitamin D. But yes, vitamin D has actually been seen that deficiency of vitamin D can cause diabetes and also cause worsening of diabetes. So vitamins to check with your primary care doctors, whether they can check your vitamin D level, and if it is deficient and needs to be replaced either naturally or they'll show you or tell you other ways to get vitamin D, depending on how low it is. But it definitely helps with diabetes management.
So I shouldn't just go run out and buy a bunch of vitamin D.
You should. I mean, you should always take your calcium and vitamin D irrespective. That definitely helps with bone health because remember, it's not just diabetes. We have to look at our bone health, especially in my females with menopausal or premenopausal age. They need to be on the calcium and vitamin D. But if people are deficient in vitamin D, significantly deficient in vitamin D, that needs to be replaced. Because it can cause you to be overweight, it can cause you extreme fatigue, and it can cause you to have uncontrolled diabetes.
So I'm feeling great. I don't feel like I have any problems, but my parents are diabetics, my grandparents are diabetics, and my sister is a diabetic. Do I need to worry?
Absolutely. Absolutely you need to worry because one of the, when I said one is insulin resistance and overweight and elderly, aging people, there's also a huge family history that can contribute to development of diabetes. You may be the perfect, healthiest, exercising, doing everything, but if you have a strong family history, you are at risk of developing diabetes. So definitely get yourself checked out.
So that brings me to another question. I'm full of questions today because this is fascinating, and thank you for clearing this up.
Absolutely.
I have a child, and there's a strong family history of diabetes. At what point do I get them in with the physicians, or at what point do we start testing? When do I know to come, I guess is the question.
Okay. As a child, American Academy of Pediatrics, AAP, recommends to get blood tested at birth, of course, and then we have appropriate ages that we have designated to check for blood glucose and cholesterol. And so that's, if you go through your annual well child exams until the age of 18, we at least check 4 times in that course, check for, development of diabetes. Again, that's just the recommended age interval that we check. But type 1 diabetes, which is very prevalent in the younger population, the symptoms are very dramatic. If your child is complaining of increased thirst, increased urination, extreme fatigue, extreme hunger, and these are some of the common symptoms, then you need to take them to the doctor, irrespective, even if they've had a recent check, because this can develop over weeks, days to weeks. So they definitely need to go in. And type 2, on the other hand, can take up to 10 years even before diagnosis. So that's when you go for your annual physicals to your doctor. And when somebody comes to me for their annual physicals, I make sure I check their A1C and I check their fasting blood glucose, and that tells me where they are at with their diabetes.
So what age do you recommend, other than adolescence, of starting a good routine of physicals?
Oh, like I said, annual physicals. Once you hit the mark 18, you anyway graduate to go to a primary care physician, an adult primary care physician. So I recommend all my patients come every single year. Medicare allows you to actually check your blood work every 2 years. But every other commercial insurance, every year, they approve of getting their blood work done. So take advantage of it. And actually, let me put an interesting fact that I noticed. The Obamacare or the marketplace insurance, they actually give gift cards to their patients for getting getting an annual physical and blood work. So that's a motivation for them to get their physicals done annually.
That's awesome. When you consider you could have type 2 and it takes you 10 years to manifest the disease, it's a good idea to get people in early.
Absolutely. And like I said earlier, if you're caught earlier, there is, we can take care of it. We can help you reverse it. And not only that, we can come up with a beautiful diabetes care plan for you, which includes your medications, carefully planned diet, exercise, controlling your blood pressures and cholesterol, and starting you on baby aspirin. All this and more if we diagnose, prevent complications.
So I'm going to throw one question out there that you may not be able to answer just yet, but let's try. COVID and its effects on diabetics. We've heard some things that it can affect the diabetes. So what is your recommendation to anybody that may have had COVID? Do they need to follow up with a physician or?
Yes. So getting COVID infection just because you're diabetic does not mean that you're increased risk of getting that infection. But when you get COVID, you have increased risk of complications associated with diabetes. So, because I told you it's a complex metabolic illness. So COVID affects the blood vessels, it affects, now we've seen that it affects your cardiac, it affects pulmonary system. So that's when you develop COVID after you have diabetes, make sure that you are following up with your primary care doctor or with your physician closely to make sure you're not developing any complications related to that.
So what else is there that you want me to know before we go? But what is it that you want the world to know?
I want the world to know that do not take diabetes very lightly. You can live a long, healthy life, and you don't have to be deprived of the food that you like, but you just have to portion control, and we have to come up with a good diabetes care plan. We have lots of tools and systems in place to help diabetics live a normal life. We have continuous glucose monitors now, which are actually the most amazing thing that in the management of diabetes has helped my patients live a very normal life, and they can manage it very easily. They don't have to be worried about lows and highs. People who have brittle diabetes can be easily managed too. But all this and more only if you follow with your primary care physician who can diagnose you and treat you accordingly. So don't take healthcare in your hands, and we are here for you.
Dr. Parkar, are you still taking patients? Because I know you're a busy doctor.
I am accepting new patients, and I'm always there for them.
Awesome. Well, I'm going to take you up on bringing you back and talking to you about vitamin D, because I think it's a great subject. And we will be posting Dr. Parkar's number if you need an appointment or see your own physician, but please make sure that you take care of yourself. It's very important. Dr. Parkar, I want to thank you for joining us today. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week. Our guest will be Dr. Enrique Garcia Pena, and we'll be discussing joint pain. Thank you, and have a great evening.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.